I'm going to give everybody a few more minutes to see if we get anybody else to jump on, then we'll get started. All right, we'll get started. Good afternoon, everybody. Happy New Year to everyone. It's been a while since we've all been together. Hope you all had a happy Christmas, Merry Christmas, and a good New Year. We are going to go ahead now and get started with our CSU update. And so, Kristen, I'll let you take it away. Oh, you're muted.
Yep, thank you. You would think I would know how to work Zoom by this time, but regardless. Hello, everyone. Thanks for joining. So yes, just to echo Brian, glad to have everyone here and hope everyone had a healthy and safe Christmas and holiday season. So I think because we didn't have a meeting in November, I'll go ahead and just kind of review some high points of both November and December. So I'll just hit the high points and then happy to answer any questions. We did have some interesting things happen in November and December, so we'll certainly discuss those, I'm sure. So for November, our referrals, we had 41 total referrals for the month of November. Of those 41, we were able to admit 19. I will say in November, the CSU was, as well as December, we were hit with COVID. We had several staff members that tested positive and had to be out, as well as several staff members that had to be on quarantine. So there was 9 days in November where we were unable to accept admissions to our unit. So that kind of explains our low admission number for November. I will say, just in comparison, even with those 9 days closed, of the number of referrals, I think we were still trending in a positive percentage for that. So even though, just to clarify, even though we were closed to taking admissions, we still had staff in our building, and we were able to triage phone calls and get people directed to crisis resources if that was something that they were needing. We also had set up a way and means for us to get people linked to immediate care within Ozark Guidance if that's something that they were needing or requesting. So we could certainly, get people seen by our medical provider if it was a situation that, required that. So we did have some kind of backup plans in place. Our average length of stay for November was it was about 62 hours. So folks, staying below that 72-hour mark and getting stabilized relatively quickly and on to their to other community resources. In terms of county referrals, Washington County, we had 30 referrals there. Benton County provided us with 8. We had 1 from Carroll and 2 from Boone. And our total law enforcement referrals for the month of November was 10. Fayetteville PD provided us with 6, Rogers 1, and then we did have 1 referral from Washington County Detention. So that's kind of the highlights for November. The month of December, in terms of referrals, looked relatively the same. We had 49 total referrals. That seems to have been that, as we've discussed, I think we've been kind of in that same vein in terms of referrals since COVID started. I will say we had a dip in November and December. I think we may be able to attribute that to a holiday and an increase in COVID cases in our area. So again, 49 referrals for December. We were able to admit 28. December, we also had to be closed or closed to admissions for 4 days. Again, we had multiple staff testing positive for COVID, and again, had to go through a quarantine process for some folks. So for December, the average length of stay was 76 hours. That is an outlier number for us. We usually are below that 72, or we're kind of right in vein with 72. We did have an outlying situation where we kept somebody well beyond the 96-hour mark. It was a specific situation. So that's kind of where that average length of stay trended up. And then our referral numbers looked relatively similar to November. Washington County providing us with 32, Benton with 11, Newton we had 1, Boone we had 1, and then Madison County provided us with 3. And then law enforcement referrals, we had 6 total referrals from law enforcement, 4 of those coming from Fayetteville PD, 1 from Rogers, and 1 from Springdale. So again, November, December hit us a little hard, a little differently, and we had to do things a little bit differently to ensure that we were, even though we couldn't take some admissions during some time, we were still able to provide services to folks and be a resource, a triage resource at the very least. I think to kind of just explain with the closure, I don't know if everyone's aware of kind of what our statement of work looks like, but we are required to have a nurse in our building 24/7. So when a nurse goes out, trying to, cover that down can be can be a challenge sometimes. We usually are pretty good at it, but when multiple go out with COVID, it makes it even more challenging. So that's kind of the summary for November and December. I think something that also just stood out was folks where they're discharging to. So generally we see folks kind of across the board discharging to multiple places. November and December both showed us that in those months, folks seem to be discharging to their home or residence. That's not to say that we weren't necessarily making connections to community resources or getting them to other programs or therapeutic environments. Those efforts would be made. I think, again, you know, some of those substance use facilities, they're going through exactly what we're seeing as well in terms of needing to change course and do things differently or take less referrals due to COVID outbreaks. So we did see a lot of folks also choosing to follow up with OSARC guidance after being here. So that's always good to see so that we can get them, you know, connected right over. So I think those are my high points. Happy to answer any questions or explain anything further.
So Kristen, I have a question. Have you had to release anybody early because of COVID, or are you just saying when you're short on staff, it reduces the number that you can safely have in the unit?
So fortunately in November, at the time that it occurred, we actually didn't have anybody on our unit. And so it kind of, you know, we didn't have to find placement for anybody. We could just, you know, handle it. In December, when we had that occur, we didn't have to release anyone early. Everyone that was, when it happened, we were able to maintain until we can get them safely discharged. And they were scheduled for discharge anyway. We did transfer one person to a higher level of care at that time. That probably would have occurred regardless.
Okay.
Yeah.
Is there anything, I mean, I see the numbers are, you know, trending up, which is good. We're getting more utilization. Is there anything that could be done or you hearing anything that may be still things we have to work on in order to get more, you know, local buy-in from law enforcement? Any issues like that you care to discuss?
I don't think anything in particular. I know in working with Catherine Griffin at the governor's office, all the CSUs, we work, you know, we have bi-weekly meetings. And just kind of a general consensus, I think, amongst all the CSUs is just ensuring that, you know, we're kind of keeping up with that outreach, you know, even with the pandemic occurring and just making sure that we're, you know, keeping those connections and collaborations alive and well. So for us, in December, we were able to do a CIT refresher course that was actually put on by OSARC guidance. So we were able to kind of offer that. It was our first time doing a refresher course for those officers, but I think that offered, you know, it wasn't a full 40 hours. It was an 8-hour session. And I think it just kind of offered a reminder of like, hey, you know, the CSU is here and here's how you utilize it. So I think we're looking to do more of those in the future. So folks that have already received or officers that have already received the 40-hour training, a 1-day, just kind of refresher reminder of, you know, different tactics that can be utilized as well as resources that can be utilized. So that's one avenue we're taking. So more formalized kind of training. And I think that, you know, just from our perspective, just, you know, being able to reach out and just kind of continue those conversations is ideal.
Okay. Like I always like to ask, is there anything that the county can do or anything you need from the county at this time? You know, that anything we can do that you're lacking or we're not taking care of?
No, I think we're doing all right. Yeah.
Okay.
Yeah.
All right. Does anybody else have any questions or updates or anything they'd like to share?
Kristen, this is Jay Cantrell. I've got a couple of questions and a comment, if I could.
Yes, sir.
One, you mentioned you had COVID in the unit in November. Where are you all at on the rollout for the vaccination? Are you in the 1B category, 1A category? Do you know when you all will be able to take part in the vaccination process?
Yes, thank you for asking that. And I should have been reminded because my arm is currently sore because we were able to receive some vaccinations. So OGC did a rollout actually yesterday. So we were able to get, any CSU staff member that was interested in receiving the vaccine, they were able to receive it yesterday, and we'll be getting our boosters in a couple of weeks.
Oh, excellent. That's great. Yeah. That's great news. Yeah. And the other thing is I appreciate these monthly reports, very informative, and I'm kind of learning now how to read them and how to interpret them. So I guess my question would be, is there any appetite amongst the group or amongst the panelists to move these meetings to quarterly? I know you still send these reports out monthly to the state, and we can still receive those reports. And I'm feeling pretty comfortable digesting them now. If there's any appetite amongst the group to move these meetings to quarterly. So I guess that's my question.
Well, on behalf of Judge Wood, I think Judge Wood is perfectly fine with moving these to quarterly. I think he would share in your sentiment, Jay, that we are getting to where we can understand these. And then certainly if something were to come up, we could always call a special CSU meeting if we needed to. But I think he is also on board for seeing these meetings move to quarterly meetings.
Thank you. I'd just like to hear from everybody else their consensus before we make that determination. But thank you, Brian. Thank you, Kristen.
Mm-hmm.
Anybody else?
This is Mike Peters. I think quarterly would be good if we could move them to that.
Anybody have any objection then to us moving to a quarterly meeting?
No objection from Joanna Taylor.
Thank you, Judge.
I'm checking with the chief right now, but I feel certain that he'll be all right with it.
Okay. Well, unless we hear of any objection from anybody, then we'll go ahead and move these to quarterly meetings. We will look to have our next meeting in April. Is that right? Yeah. Or the beginning of the next quarter in April. And so I'll make sure that we send out, we kind of plan these out, and we send out the information to everybody as far as when the next meeting will be. We may try to get all of them kind of on the calendar if we can for the rest of the year. And then, like I said, if anything comes up or anything happens, we can always call. If Kristen's got anything that we need to discuss, we can always come together, get together and have a special meeting as always. And we were kind of late because how these things get set up, and that you set them up for a period of time and then it ends on your pre-scheduling. And so it drops off. So to the public, I know Beth reached out to me earlier in the week, like, hey, I haven't seen anything. We'll get these scheduled. I'll make sure we get them on the county's calendar. And then it also lists, as we do with our core import meetings and all of our other meetings, that it also has the links for the Zoom logins for the public. And, Kristen, one question I get, and just want to make sure, I know you send it out and I probably get an email about it from somebody. Do you have that data available if somebody were to contact you, where you could, just the number sheet, the data, the statistical stuff we send out, can they contact or email you to get that?
Yeah, that would be fine. I've kind of filtered some of those emails here recently, so that's fine.
Okay. Well, as I've stated to people in the past, I mean, you are the one that creates those documents, and therefore you are kind of the custodian of all those records. And so I feel more comfortable with you, and you're welcome to give them out however you wish. That's up to you in any form or any stats or statistics that come out. So anyways, just want to make sure we hit that. Is there any other questions or anything else? I know we all love meetings, so there'll be plenty more. Well, I appreciate it. Good seeing everybody, hearing from everybody. Y'all take care and be safe. And we look forward to seeing everybody again in April. If anything comes up or you have any questions, don't hesitate to reach out to myself or Judge Wood. We'll be happy to address those questions or concerns or issues as they come. Take care. Y'all have a good day.
Thanks, Brian.
Thank you.
Thanks.